Doctor, it's great to see you. I guess as we talk about more and more states reinstating the mask mandates, or more and more local officials, I guess is a better way to put it, reinstating the mask mandates, is this the right move at this point as we see the number of cases climb across the country?
Well, the problem has been that because we've done a less than stellar job at vaccinating the country, we have entire regions with very low vaccination rates, especially here in the South and in the Mountain West region and other areas. We don't have a lot of other options. So I think the goal is to maximize what we call NPI, non-pharmaceutical interventions, to try to compensate. It's not as robust as vaccination, but what can you do if there's whole segments where vaccination rates are low? Especially here in the South, fewer than 15% of adolescents in many states and 30-40% of young adults. So this virus is going to accelerate through. The tragedy, the other irony or tragedy is the fact that the groups that are reluctant to get vaccinated are probably also the groups that are reluctant to wear masks. So, it's really frustrating when you see this train coming down the track from 2 miles away, and there's not much you can do to halt it.
To that point, Dr. Hotez, Anjalee here, looking at the cases largely in the South, I know that there's been a lot of pressure, especially on social platforms like Facebook and Twitter, to help curb misinformation, the White House directly calling them out. Meanwhile, we know that former White House COVID advisor Andy Slavitt recently spoke to a vice president of Facebook and discussed this issue. Listen to what he had to say.
The distinction is where we think there's a clear harm, that if you believe what you're being told, there'll be kind of imminent real-world physical harm, we remove it. And that line, by the way, changes all the time with the science. We can't cleanse the internet of everything, just people just talking nonsense or of satire or of hyperbole. That's crazy. We can't do that. But we can go after the stuff where we've been clearly advised that this will lead to real-world harm.
So as you can hear, that's Nick Clegg talking about the role that the company has to play in not being able to really cleanse the internet and also having to strike this balance between finding misinformation, shutting it down, but also protecting free speech. So I just wonder, we know that there is a dozen groups and individuals that have been identified as being largely responsible for this misinformation. What are your thoughts on that, on sort of the role social media has to play?
Yeah, no, Anjalee, I think there's two important pieces to this that need to be mentioned. First, in terms of what Antiscience has done to the United States of America, the reason why 600,000 Americans lost their lives from COVID-19 is in part due to the SARS coronavirus type 2, but in equal measure, it was defiance against masks, social distancing, defiance now against vaccines. Death by anti-science. So when you look at all the big things that organizations like Facebook or social media companies have no problem shutting down, like global terrorism or nuclear proliferation or cyber attacks, they have no problem with that. Anti-science is a far greater killer. Anti-science kills more than all those three other things combined. So there's this lack of understanding about the dramatic impact on life or loss of life from the rise of the anti-science movement. In fairness to Facebook and other social media platforms, focusing exclusively on them is not warranted either, because it doesn't get to the source of the disinformation. Yes, Facebook is a vehicle for spreading it, but it doesn't get to what I call the triple-headed monster, the three sources of the disinformation, which are in no particular order: far right-wing extremism in the U.S. now going mainstream across elements of the GOP, and we're seeing this play out nightly on Fox News, on Newsmax, other conservative news outlets. We saw it at the CPAC conference, members of Congress, waging war on scientists and scientists, so elected members of the Congress and a lot of the red state governors. That's an important piece. The other two are the organizations recognized by the Center for Countering Digital Hate. And it's amazing we have to have an organization called the Center for Countering Digital Hate, which has identified a dozen organizations they call the Disinformation Dozen. We have to do something about them. And lastly, the one almost no one talks about, which I think is of equal importance or even greater importance, is the Russian government under Putin, which has led this war of aggression through this carefully orchestrated campaign of weaponized health communication to divide our democracy. So going up against Russia and Putin. So those are the things that we need to do. So Facebook needs to step up, and the other social media platforms recognizing how dangerous anti-science is. But then also the Biden administration needs to come up with a plan to really go after that three-headed monster, as I call it, which so far they are kind of skirting around the edges.
Well, definitely on that point, we know that from the federal side of things, we have the Surgeon General with his advisory last week, and Senator Amy Klobuchar also talking about introducing a bill that addresses that and strips legal protections for these companies. So you've said that none of those go far enough.
Yeah, that's right. So again, I mean, putting your thumbs and to Facebook, I think put some levers in place for Facebook to make them more aware of what needs to be done. I think that's an incremental step. I think some of the other things the Biden administration is proposing, I mean, there's nothing bad there. It's all moving the ball in the right direction. Sorry for the overuse of metaphors here, but it doesn't get to the heart and soul of the anti-vax, anti-science monster. And that's what we need to do. And the only way to do this is to recognize that just focusing on the health sector alone won't do it. We need advice from Homeland Security, from Commerce, from the Justice Department, from the State Department on how you really start dismantling this evil empire that's been enabled for so many years, even decades.
Doctor, very quickly, what can you tell us about what we know about the rising infections among, say, kids under the age of 14, or is it teenagers? What are we seeing right now, and what can we do if these children can't be vaccinated to protect them?
Well, we are seeing an uptick in hospitalizations, mostly in young adults. Now we're seeing adolescents going into pediatric ICUs and some kids. I don't think this virus is selectively targeting kids and adolescents. I think what's happening is anyone who's refused vaccination or is not or is ineligible to be vaccinated is just getting swept up in this. And the best way to protect the youngest kids who are not eligible to be vaccinated is to maximize vaccination rates among adolescents and young adults. And again, if you look at what's going on in places like Louisiana, and where fewer than 16, 17% of the adolescents are vaccinated, and you have low vaccination rates among young adults, and you have some of the red state governors refusing to allow mask mandates when schools open up starting in a few weeks. I don't know what it is that people think that's gonna go well. So I think being mindful of what we're in store for as we head into the school year is really, really important.